Welcome to The Real Pro-Choice, where you will hear stories of miraculous healings and restoration. So, you've taken the abortion pill and you're having second thoughts? My next guest is going to tell you how to reverse it.
The choices we make affect our lives. Sometimes our choices not only affect our own lives, but everyone connected to us. Maybe even those we're not aware of. God says, choose life, so that you and your descendants may live. Join Donna Grisham and her guests as they share the choices they've made and how Jesus has set them free. Next on The Real Pro-Choice.
Welcome to today's show. Today's guest is Dr. Matt Harrison. Welcome, Dr. Harrison.
Thanks for having me. Pleasure to be here.
It's good having you. Tell us a little bit about yourself.
Okay, I grew up in Lynchburg, Virginia. Went to school in Williamsburg and then medical school in Richmond, Virginia. Between that time, I was doing a lot of research in childhood leukemia and Alzheimer's disease. I was on staff with Young Life out in Colorado for a while. But after medical school, I did my residency in Mobile, Alabama, was chief resident there, and then I came up to the Charlotte area for my first job. So I was working in Concord, inpatient, outpatient, and obstetrics. So to this point now, I'm a full-time hospitalist. That means I stay in the hospital and have been fighting COVID for the past 2 years. But then I have a prenatal clinic, a charity clinic in Monroe, North Carolina, with HELP Crisis Pregnancy Center. And so we see women there for free that need prenatal care. A lot of them come right off the sidewalks from the abortion clinics. And then I also am the medical director at the Student Health Clinic at Belmont Abbey. I'm a medical advisor for Priests for Life. I do some mission work, mainly now in Ghana, Africa. And a few other hats that I wear, but I stay busy. And the best thing is that I'm married to Kathleen, my wonderful wife, and am the father of 10 children, 3 in heaven and 7 here, and they're all doing great.
Wow. Yeah. Okay, good. Well, you know, do you have an antidote for what they call the abortion pill? Now, I want to go into, first of all, let's just talk about the abortion pill. What is the abortion pill? I mean, a lot of people may know that, but there may be some people that might not know that. The abortion pill, and what does it do? Okay.
Yeah, and some people confuse it with the morning after pill, and those are different things.
Right.
So the abortion pill, otherwise known as RU46, which is kind of the scientific experimental name, and then mifepristone is its generic name. And so that is a medication that's been around since about 2000 in the U.S. It was made to essentially block the progesterone receptor. Women will take the tablet in the abortionist's office, and then they'll watch them take that, and then they'll go home. And so what that pill does is it blocks the progesterone receptor, which is a vital hormone during pregnancy, blocks it kind of in the uterus lining, and essentially shrivels up the blood vessel and the supply to the baby. And so the fetus then essentially starves, does not get proper nutrition or blood flow nutrition, and then it separates away from the placenta, separates from the uterus. So then 48 to 72 hours later, a woman takes a medicine called Cytotec or misoprostol, and then that starts contractions. And so that will then have them expel the fetus and the dead baby at home normally.
Right.
So it can be, a very bloody and painful experience. We're seeing, as this is becoming more prevalent, this medication used to be a very small percentage of abortions. Now it's essentially about 50% of all abortions in America are done with a medical abortion or chemical abortion, we call it, instead of a surgical abortion. And we're finding that these are actually much more dangerous in the long run than surgical abortions, which are dangerous in themselves. But the complications with the medical abortion pill is that it causes bleeding. Women will have cramping, they'll have infection. Sometimes you have retained products that become infected, and women need transfusions or even surgeries to stop the bleeding. So we're seeing a big uptick between the years 2005 and 2015, over 500-time increase in complications using the abortion pill. And now they're talking about telemedicine abortions, which will use the abortion pill that's far away from any civilization or any type of medical help. So we're really afraid for these women who are taking this abortion pill, especially out of sight of any doctor or medical care.
Right. So in other words, when you say that means they can call in and they'll mail it to them, correct?
Well, normally what they're doing is they have a clinic, a brick and mortar clinic where women go to. They're supposed to have an ultrasound to make sure that the fetus is in the uterus and not anywhere else in the abdomen. And then after they're interviewed by a provider, that might be a doctor, it might be a nurse practitioner, or somebody else, then they have a dispensary right there that unlocks, and the woman takes the pill there and then goes home.
Okay.
Yeah.
Okay.
Now, people are definitely getting this medicine over the internet and mailed to them, and they're getting it from friends. We see this all the time.
So it is happening.
Oh, yes. We see this all the time, even in Charlotte, North Carolina.
Okay. Okay. So, but you came up with the solution to reverse that, to reverse the abortion pill. Can you tell us what that was and how you came up with that?
Sure, absolutely. So in 2016, I was in my clinic on a Thursday afternoon. I received a call from a crisis pregnancy center. We have relationships with all the local crisis pregnancy centers because, we would see the crisis women for prenatal care, and then we do their deliveries. And so they said they had a 19-year-old lady who had come in and had kind of been pressured into an abortion, had taken the abortion pill, but she changed her mind. And what should they do? So I said, well, send her over to the clinic. So she came over and had her placed in a room. She had been kind of forced into this abortion, pressured by her boyfriend. She was a Christian, did not believe in abortion, and as soon as she had taken the pill, she never got to even see the baby in the clinic, and she was a little more than 7 weeks along. As soon as she took the pill, she regretted it. She went out to the parking lot. She felt sick to her stomach. She went home. She cried, and after about 24 hours, 36 hours, she went and told her mother. Her mother, instead of being mad, instead of kicking her out, instead of doing all the things that her boyfriend threatened would happen, she said, I want to help take care of my grandchild and my daughter. So she took her to the crisis pregnancy center, brought her to me. And I said, I really don't know what to do in this situation. This is not something they teach you in medical school. Let me step out, pray about it, think about it. So I stepped into my office out of her exam room and started looking through the physician desk reference at how RE46 works, realizing that it's a progesterone blocker. Now, I'd already done a lot of research and published in receptor biology and how receptors work and that type of thing. I knew that in most cases, a chemical will not bind to a receptor and never let go. It's always in a state of flux. And some receptors or some chemicals will bind to a receptor stronger than others. So RE46 binds to the receptor quite strongly, but it's not on there 100% all the time once it's bound. So I knew that if we could put good progesterone, good keys into her system, a good chemical into her system, an extra of it, then we could probably outcompete the RE46. So I presented this plan to her. Now, progesterone has been used for 50 years in pregnant women, and it's been very safe and effective, and shows no signs of birth defects, and we've used it in fertility treatments, and we happen to use it in our own clinic for fertility treatments because my partner, Dr. Danny Holland, is a Creighton fertility specialist. And so we had it in our clinic, and so I said, what if we give you progesterone, not a huge dose, but essentially enough to maybe outcompete that RE46? It really might work. And I said, this could be a risk. I don't know, because this is not something that's been done before. And so I explained to her. She said, I don't care. I want to do what it takes to save my baby. And so she took the injection, and we hoped for the best. The next night, Friday, we got a call that she was bleeding, and we thought for sure she had lost the baby. So we told her to go to the emergency room where we knew the doctors. They knew how we practiced medicine, and they did an ultrasound. She got to see her baby heart beating, and she was so excited. And so they said, go ahead and hope for the best. A pro-abortion doctor could have said, well, let's just do a D&C. But she came back to home, was fine, that she stopped bleeding, and Monday came to our office. Baby was still living. We completed supplementation up through the first trimester, and at 40 weeks, she had a perfectly healthy baby born, and is now going to turn 15 next week.
Wow. Well, there's much more, and we'll be right back right after this.
God values all life, even from conception. Donna Grisham and the vision of her ministry, Journeys of Choice, is to empower women through counseling, parenting classes, and by providing alternate options to choose life for themselves and their unborn child. With prayer and dependence on God, Journeys of Choice is committed to saving the lives of unborn children, while at the same time offering courage, assistance, and healing. For more information, visit journeysofchoice.org.
Welcome back. I'm here with Dr. Harrison. Dr. Harrison, you just told us an amazing story. Could you finish this?
Sure. So after that happened, it's not every day that you have someone who's taken an abortion pill come to your office. And so I didn't know whether it was a fluke or whether there's, something to this, but it made perfect biological sense. So I started, I talked with Father Pavone about it because I was a medical advisor for Priests for Life. He did a little interview on the internet. It started to get a little bit of traffic. And then I started getting calls from other doctors around the world who were wondering about this and wondering about the protocol I used. So I gave them the protocol that I used, and they started to have situations where they were starting to use this protocol on other women. So in end of 2011, and into 2012, Dr. George Delgado contacted me, and he said, I'd like to use the story of the first abortion pill reversal in a paper I want to publish. So in 2012, December, he published in the Annals of Pharmacotherapy essentially a case report on 6 women who had sought abortion reversal. 6 of these women had taken the abortion pill. They were given supplementation. 4 out of the 6 were able to successfully reverse their abortion, and those babies did fine. So, and interestingly, as I got to know Dr. Delgado, who is in California, he kind of ended up being kind of the West Coast representative for this, and I kind of handled the East Coast. Interestingly, 2 years after I'd done mine, he had come to the same conclusion and had reversed an abortion the exact same way on his own without ever hearing about mine. So it's kind of comforting to me to think, oh yeah, other doctors are thinking that this would work. So after that, we started to grow a network. We started to get other providers that would be willing to reverse abortions. That's not an easy thing to do because this is an off-label, use of a medication. It's an emergency, essentially an emergency situation where we're trying a last resort. But it was safe, and that's very important. It's very important that any medical treatment that is safe for women and their babies. And so over time, this grew. And to date, now we have had over 1,100 providers worldwide that can reverse abortions in 65 different countries, all 50 states. Our goal is to get abortion pill reversal available within an hour of any woman that wants to reverse their abortion. And we have had over 3,000 babies that have been born healthy after reversal.
Wow. And now tell me the years when it started, when you got, and then, because how many years have you been doing this?
So it started in 2006. Little Kaylee was born in 2007.
Okay.
And then my next abortion reversal was probably not until about 4 years later, 3 or 4 years later. And up to this point, I personally have probably reversed about 12, a couple of sets of twins, which is always exciting. And then Dr. Delgado published his paper in 2012. And then he published another paper that had over 750 women in it, about 550 qualified to be included in the study, and it showed a 68% reversal success rate in women who took the protocol correctly. Overall, almost 50% in some women who didn't even finish the protocol.
And so this is worldwide? Worldwide.
So yes, that's worldwide, yes.
Okay. So as far as the United States, do you know how many in the United States that
I don't know the exact number in the United States. It's somewhere over 2,000.
Okay.
I know that they get about 150 calls per month. Heartbeat International.
Okay.
They took over that, I think it was 2016, and have done a fantastic job because they have over 2,500 crisis pregnancy centers worldwide that can tap into this and have really expanded these services for women who need it.
That's wonderful. That's wonderful. So there is an 800 number that somebody can call if they are in that predicament, if they're in that place where they've taken that pill and they want to reverse it. They've changed their mind. And that number is 1-877-558-0333. So I just, so if you're at that place and you've taking that pill, because I know when you're in that crucial moment and you've got all these voices coming at you and these voices are saying, this is the answer, this is the answer, and then there's something inside of you just struggling and you're saying inside, even though you really don't know the answer, but there's still a struggle inside of you. I would encourage you to call that number, and again, that number is 1-877-558-0333. Dr. Harrison, I tell you, this is just really, I think this is a lifesaver. Not just a lifesaver for babies, but it's a lifesaver for women.
Sure. Because
I'm telling you, the trauma, and I know because I've been there, the trauma that a woman goes through from having an abortion.
Yeah.
And they live with the thoughts of it, until they get healed, until they get to that place where they've allowed Jesus to come into their heart, they've allowed Jesus to come into their life and just cleanse them and clean them up and erase every bit of their past, because we're not, our past doesn't define us. But tell me, as far as, do you have any other experience besides Katie that you would want to tell us?
Sure. Well, the biggest thing is that, we do have these women who have avoided abortion because of this, and they're very, very grateful. But also the women who have unfortunately completed their abortion, even though they took the treatment. They have come to us and said that they have felt great relief because they realized that they did everything they could to help try to save their baby, even after the baby had already been attacked by RU46. So, they are not suffering nearly as bad as the women who have completed the process, took that second pill, and completed the abortion intentionally. These women have tried, and that's a real emotional healer for them, and that's where they start healing. So that's been a real blessing for a lot of women.
Yeah. Well, I know that, and I want to go back to the thing with the online. I mean, where they can get the pill online. Right. That's very important. That it's and I think it's, if I'm not badly mistaken, it's already people can call in, they can get it, and they'll mail it in. Now, tell me how that works, because I'm not sure.
So they don't really necessarily mail it in, even though people do order it and it's sent illegally. But the legal way they're doing is that they have the medication already at the clinic where there is not a provider, or or they have an ultrasonographer. But what's important is that women the other way they can access this reversal is by going to our website, abortionpillreversal.com. or abortionpillrescue.com. And if they are at the abortion clinic and want to search it on their phone, they just Google abortion pill reversal, and we have people working on the mobile apps to have them be able to access it that way.
Well, Dr. Harrison, you're not just on the medical side of things, you're on the spiritual side of things. You've been out to some of the abortion clinics and you've ministered, you've prayed, you go out there and you pray for women. I've seen articles where they've had you kneeling in front of the abortion clinics. So when we come back, I want you to just tell that story.
Okay, sure.
We'll be back right after this.
I invite you to visit journeysofchoice.org and get this book. You may be in a situation where you are at a crossroads between the choice of life and the choice of death. Life may have stopped for you, and you are fearful of what your future holds. Abortion, rape, adoption, and more are covered in Donna Grisham's book, Journeys of Choice. Donna shares her own story, along with 14 additional inspiring testimonies from both men and women who were at a crossroads. Each one shares the choices they made and how those choices affected their lives and the lives of others. Their words offer wisdom for making godly choices in the midst of trauma and crisis, and bring hope, healing, and supernatural redemption to anyone with a broken past. As you read these pages, you will see for yourself the truth behind choice and the effects of the choices we make. See how God wants to intervene in your situation and change the course of your life forever. Find hope and healing for those who have been faced with an unplanned pregnancy. Know that God has not left you and wants to bring hope to your hopelessness. Every testimony in this book, Journeys of Choice, will bring healing and hope to the brokenhearted, revealing what was meant for evil and harm, and show you how God can turn it around for good and blessings. This heartfelt book will inspire, motivate, encourage, and assist you on the road to recovery that will bring a wellspring of hope into your life and others. Get your copy today.
Welcome back. I'm here with Dr. Matt Harrison. Dr. Harrison, we've been talking about your invention of the abortion pill reversal and how the effects of that and how that works. And, you know, the last segment I mentioned that you're not only on the medical side of things, you're on the spiritual side of things. You really have a heart. It's not just about the medical part of it. You have a heart for this, to save the unborn. And I know you've been out to the clinics. I don't know, I do know you've been out to the Latrobe Clinic here in Charlotte, North Carolina, which is one of the largest, I think, the largest abortion clinic that has the most abortions throughout the Southeast.
Correct. Yeah.
Correct?
Yeah.
Okay. Tell me just a little bit about some of your experiences when you go out there and just speak from your heart.
Sure. So, it's always a painful place to go.
Yeah.
I always kind of get a knot in my stomach when I'm driving up, even after 20 years of doing this. And, so many of the women there are very hurt. They've been very damaged. They have a lot of walls up and a lot of, defenses up. And so, I think it's really important to go there understanding that and having compassion for the moms, the dads, and all the people that are there, for the workers that are there. I try not to fight and argue with anyone. And sometimes, they can be very distracting and very attacking. And so generally when that happens and they don't really want to have a dialogue, I'm happy to have a dialogue with anyone there. Sometimes I have really good conversations about the science and about some of the morality surrounding this. But when it gets to just an attack, then I generally just, try to quietly pray for these folks that are, hurt and damaged. And, all these people are looking for love. They're looking for relationship. They're looking for happiness. And I think that the people on the sidewalks have the answer to that and can help them a lot. And there's a lot of forgiveness and healing that needs to go on. A lot of them have been abused by the medical society.
Exactly.
They've been taken advantage of. They've been lied to. It's very hard for them to trust anyone. So I try to be there to kind of be a voice for reason, for logic, for compassion, and for the medical world that cares, for pro-life medicine, which to me should be redundant, but unfortunately it's not. And so that's what I try to do, just be there to offer help to women, to offer. We have a mobile unit that goes down there, has an ultrasound on it. They can come right onto the mobile unit and get an ultrasound of their baby and see the baby with their own eyes. If we need to do a reversal, we can start it right there on the sidewalk immediately and have follow-up care that's needed. And so we're there to provide services, there to provide hope and compassion. And, I think that's the key. We're not there to yell and to scream type of thing. We're there to, try to help those moms.
Right. I love, I know Justin Reeder with Love Life Charlotte, and then, the Benham brothers, Philip Benham's been going out there for years preaching the gospel. And you know, these women, they hear the gospel, they hear the love of Jesus, you know. And I love I love Justin Reeder's vision for the church, mobilizing the church to get involved. I love that. But you know what? There's also another side of this. There's a legal aspect to this. Do you want to talk on some, you know?
Sure. So, yeah, the legal issues that we're finding is that we've been coming under attack by Planned Parenthood. And the thing is that there have been medical providers that have been lying to these women, saying that there's no hope for your baby, you need an abortion, take this pill, everything will be fine. And we find that to be very untrue. And so what we've been doing is we've been putting legislation in place to help protect these women and to give them, like the title of your show, the real choice. So they actually have a choice to reverse their abortion. The pro-abortion industry attacks us and says, you know, we're doing something against women. But we're really giving them a choice to say, hey, if you want to change your mind, and we know that women do many times, then you can reverse this abortion. So in 13 states now, there's legislation enacted to add informed consent laws so that when women go in for an abortion, they're given information that if they change their mind, here's a 1-800 number, here's a website that you can go to. And of course, this drives the Planned Parenthood folks crazy because now they are forced by law to give this information to their patients. So we've been fighting that in a bunch of states. Other states are doing this as well. But it's a way that we've found, you know, I don't like the government telling me how to practice medicine, but when medical providers are giving bad information, doing dangerous things, women need to know about it, and they need to know that they have the right to change their mind and have a safe way of reversing their abortion.
Right, and you know, and you even talk about pro-choice. I mean, really, if you stop and think about it, pro-choice is really not pro-choice. It's not about, they say, oh, we're helping the women, we're helping them, but really they're not helping the women. It's causing more pain, more heartache. You know, the baby dies, the baby suffers, which is horrific, and then you've got a broken woman. But not only that, you've got a man also that I've heard stories of men that, you know, have taken their girlfriend or their wives or any, you know, and they've been broken. You know, I have a story in my book, Michael Lombardo's story, amazing story that, you know, he took his girlfriend and after he did that, he regretted it. He basically went into alcohol and drugs and just, you know, but God, you know, redeemed his life, and I had to have that redemption story in my book, you know, so Journeys of Choice.
Yeah, Dr. Donna Harrison, no relation, has done a lot of work with depression and the emotional effects of abortion on women. And of course, that's one of my screening questions when women come in, or men come in for depression, is abortion in your past history? And it's amazing how many of them do have it.
Exactly.
It's amazing.
Well, Dr. Harrison, thank you so much for being with me today.
Thank you so much.
Thank you for joining us today. Visit my website, journeysofchoice.org. I would love to hear from you. See you next week on The Real Pro-Choice.